On this Friday night, disappointing deja vu. From traveling to holiday gatherings, restrictions are returning as Omicron tightens its grip.
We must take steps now to slow the rapid spread of this variant.
What this means for those short road trips to the U.S., where the president has a dire warning.
We are looking at a winter of severe illness and death for unvaccinated.
A 10-year-old Afghan girl murdered by the Taliban.
This should shock the conscience of every Canadian.
Her death ignites new urgency for Canada to act faster. And sounding the alarm about wild pigs. Why scientists say these feral hogs are ecological train wrecks.
Global National with Donna Friesen.
Good evening and thanks for joining us. It is becoming clearer just how rapidly the Omicron variant is spreading. Case numbers are surging in multiple provinces and public health restrictions are being reimposed in several provinces. Last week, more than 5,000 daily COVID cases, including Delta, were reported across Canada. That is 45% higher than the previous week, and Omicron is quickly accelerating the spread. Today, Ontario Premier Doug Ford announced that starting on Sunday, most indoor public settings, including bars, restaurants, and grocery stores, will be reduced to 50% capacity, and indoor social gatherings will be limited to 10 people.
The experts have been very clear. Nothing will stop the spread of Omicron. It's just too transmissible. What we can do, and what we're doing, is slowing it as much as possible to allow more time for shots to get into arms.
BC and PEI are putting in restrictions again. More on that in just a moment. And the federal government is making changes to its travel rules, ending the ban on travel from 10 African countries and reinstating PCR tests for short trips across the border. Abigail Bimman is with me from Ottawa. Abigail, let's start with those new restrictions in Ontario.
Well, Donna, people across Ontario need to rethink holiday plans in light of these new restrictions. They will affect everything from how many people you can host to lining up at grocery stores once again for your supplies to how late you can stay out at a restaurant with a cap on the number of people in your party. And the guidance to get together with fewer people this Christmas and New Year's is not just being given in Ontario, but right across the country. Get used to seeing these long lines for newly available rapid tests.
My parents are going to visit my grandmother for Christmas, and they want to make sure that they're not going to be bringing her COVID.
As provinces step up restrictions and make changes to try and lessen the Omicron onslaught.
Public health reached capacity several days ago, and now our testing program and the lab have also reached capacity. Many of you who are positive will have to self-manage your case without hands-on support from public health.
It's clear Omicron will not take a holiday.
It's important for people to realize that this is very both dramatic and critical.
The federal government announced changes too, lifting the flight ban on people coming from 10 African nations and reinstating a PCR return test requirement for people who leave the country for less than 72 hours.
If it's to discourage people saying, oh, you're going to have the hassle of having a molecular test, that doesn't seem to have much science.
The health minister and doctors didn't offer scientific evidence for the new tests, nor would they say whether that's the last change coming before the holidays.
Things will continue to change unless the situation doesn't change and new information doesn't arrive. No, things will keep being adjusted.
People coming from the U.S. still don't have mandatory arrival tests for now.
Preparing to increase significantly the capacity around the land border with the United States.
There are currently nearly 350 cases of Omicron across 11 provinces and territories. So far, all cases are asymptomatic or mild. Dr. Theresa Tam says we still don't know enough yet about Omicron's severity, and even if it is more mild,
it is so transmissible that even a small rate of severe outcomes could result in a high enough hospitalization rate that it can overwhelm the system.
Dr. Tam is asking Canadians to carefully consider and adjust holiday plans, and more provinces are taking steps to discourage Canadians from gathering in large groups. But this time around, public health leaders understand they're up against not just the new variant, but extreme COVID fatigue from a population done with restrictions. Donna?
All right, Abigail Bimman in Ottawa, thanks. British Columbia is also reimposing restrictions. Dr. Bonnie Henry says she knows it's going to be discouraging for people, but as of Monday, limits on indoor personal gatherings are back, and all organized New Year's Eve events will be cancelled. Keith Baldrey is with me from Victoria. Keith, what is Christmas going to look like in BC?
It's going to look a little like last Christmas when we also had health orders in place. So basically small and uncrowded. The key here is to prevent people from gathering in large numbers in indoor settings. So like Ontario, limiting to just 10, the number of people allowed in your household or members from one other household. 50% capacity in large venues, which means only half the crowd allowed at Vancouver Canucks games or junior hockey games as well. A suspension of all sporting tournaments in BC, which means that traditional youth hockey tournaments that often take place in most provinces in BC will not be allowed until the end of January when this health order expires. A big impact on the Canucks, of course. No more sold crowds there with 50% capacity. But we're not going as far as Ontario's going in terms of restricting activities in restaurants. There's no limit on alcohol sale cutoffs. There's no limit on capacity reductions in hospitals. So again, matching Ontario and some restrictions, not going as far in others. Donna?
All right, Keith Baldrey in Victoria, BC, thanks. The numbers do paint the picture of how fast Omicron is spreading. Ontario and Quebec are both reporting more than 3,000 new cases today. Quebec, Nova Scotia, and PEI have recorded their highest daily caseloads since the start of the pandemic. Manitoba and Prince Edward Island are also limiting personal gatherings to 10 people. PEI's chief public health officer says the variant spreads with very little contact and every day counts.
We will not be able to stop Omicron or prevent its impacts. However, we must take steps now to slow the rapid spread of this variant.
The UK is ahead of Canada, and for a third consecutive day, it set a new record for COVID-19 infections. More than 93,000 new cases were reported there today, a nearly 60% increase in daily infections compared to a week ago. London is a hotspot, and hospitalizations there have risen by a third in a week. New modeling that has not been peer-reviewed suggests without more restrictions, it's possible deaths could begin to rise fast and reach 5,000 a day later this winter. Across Europe, countries are reimposing restrictions to try to slow the spread. Starting Monday, people in Switzerland will be required to work from home. Unvaccinated people will be barred from many public venues. In Denmark, theaters, museums, and concert halls will close. And in Ireland, there will be an 8 p.m. curfew in pubs and restaurants starting Sunday. In the U.S., an Omicron surge is now considered inevitable, and cities like New York and Washington are reporting record high numbers in the last 24 hours. Hospitalizations are on the rise, and restrictions are slowly coming back in some places. As Jackson Proskow reports, the most urgent warnings are for the unvaccinated.
In a return to the early days of the pandemic, long lines for COVID testing are back across the U.S. amid surging case counts and dire warnings.
For unvaccinated, we are looking at a winter of severe illness and death for unvaccinated.
As Americans prepare to travel in record numbers for the holidays, the Omicron variant is rapidly taking hold here too, mixing with an existing surge of Delta variant cases that had already pushed many hospitals to the brink.
These patients do not improve overnight. They do not improve over days. It's weeks and weeks and weeks at a time.
Experts have warned Omicron cases risk swamping hospitals and sidelining large numbers of doctors and nurses.
If you have a lot of hospital workers, nurses and doctors and ICU staff calling in sick at home because they have symptomatic COVID, that's going to really tax an already strained health system.
Already there are signs of what may soon come. Major sports leagues have started postponing games with dozens of players and staff testing positive. In New York, parts of Broadway have gone dark again. The city's famous New Year's Eve celebration may have to be scaled back, with transmission already fueling record high cases.
We're going to watch very carefully. It's still, more than 2 weeks away. And if at any point we need to alter the plan, we will.
If vaccination is a leading defense, the U.S. is in a world of trouble. Just 61% of eligible Americans are fully vaccinated. Only 30% have had booster shots.
Get vaccinated and get boosted. Mask in public indoor settings, physical distancing, hand washing, improved ventilation, and testing to slow transmission.
That advice is unlikely to stave off a dark and worrying winter, with models suggesting a nation that has recorded more than 800,000 COVID deaths could surpass 1 million lives lost by the spring. Jackson Proskow, Global News, Washington.
Questions about Ottawa's response after a young Afghan girl was killed by the Taliban while her family waited to come to Canada. That's coming up. We are getting lots of reaction to a story Jeff Semple filed yesterday about the death of an Afghan girl. 10-year-old Nazifa was killed last week by the Taliban. Her father used to work for the Canadian military, and the family was approved to come to Canada. They were on their way to get passports when the girl was killed. As Jeff reports tonight, her death is raising questions about why the family wasn't rescued sooner.
Canadian veteran Robin Rickards is delivering a housewarming gift to Thunder Bay's newest residents, this family of Afghan refugees. Rickards served 3 tours in Afghanistan alongside interpreter Mohammed Zarif. As the Taliban took over last summer, Zarif's family escaped to Pakistan. But their happy reunion is being overshadowed by the news about 10-year-old Nazifa. The Afghan girl was also preparing to come to Canada before she was killed by the Taliban.
An entirely preventable tragedy. The folks that worked with us, the folks that worked hard for us, them and their families are left behind, and increasing numbers of them are being killed. And it's as simple as that, and the government refuses to do anything.
Nazifa's father worked alongside the Canadian military, and the family was approved to go to Canada. They'd made the long drive to Kandahar to apply for passports, which could have allowed them to escape to Pakistan. But after driving through a Taliban checkpoint last week, one of the guards suddenly started firing at the vehicle. Nazifa was shot in the head. I am begging the Canadian government to help us, her father says. Not just my family, but all the others who supported Canada's mission. If we're not evacuated soon, this will happen again.
This should shock the conscience of every Canadian. It is unconscionable, and it is the kind of thing that motivates us to do more and more.
Global News asked the immigration minister what more the government will do to help those who helped Canada and are still trapped in Afghanistan.
We're dealing with a territory that's been seized by, as I said, the Taliban, a terrorist entity. We're dealing with a complete lack of access to a working airport.
But Kabul's airport is operational, and the Taliban has so far not prevented Afghans with Canadian visas from leaving. Canada's conundrum is where and how to process their biometrics and security checks with no diplomatic presence in the country.
Telling people that they need to go and get the necessary documentation and the visas and the passports and the bureaucratic red tape is not going to work, and that's going to cost lives.
A new special committee of MPs met for the first time this week and is investigating the government's handling of the Afghanistan crisis, which will now include questions about Nazifa's case.
We need answers from the Trudeau government as to why this was allowed to happen.
In the meantime, Bashir, his wife, and other children are mourning the loss of their bright little girl as they wait for the Taliban to issue their passports. Jeff Semple, Global News, Toronto.
As Omicron cases surge, what can you do to protect yourself? Ahead, we take your questions to the experts. Well, it is beyond exasperating that we're back into this phase of the pandemic, back to trying to figure out what this virus is capable of. We do want to try to answer some of your questions. First, there's some new modeling from Imperial College London today, which used data from England, and it shows Omicron largely evades immunity from past infection or 2 vaccine doses. It estimates risk of reinfection from Omicron is more than 5 times greater than that of the Delta variant, and that implies any protection afforded by past infection may be as low as 19%. And vaccine effectiveness is between 0 to 20% after 2 doses, between 55 to 80% after a booster dose. That study not been peer-reviewed yet. With me from Halifax is Dr. Lisa Barrett, an infectious disease and human immunology expert. Dr. Barrett, thanks for being here. You know, we thought getting double vaxxed was going to get us out of this. Omicron is a game changer. What is the single best thing Canadians can do now?
Well, believe it or not, the single best thing Canadians can still do is get vaccinated. Even though you presented those numbers, there are still variants of other types around. And you know what, 55 to 80% protection, and probably about that amount from death and hospitalization is still a heck of a lot better than not being vaccinated. And so right now, vaccination is the key thing, layered in with a little bit of moderation for our upcoming holidays. Two good things for Canadians to do.
And getting that third dose especially is what's key right now.
For sure, if you have access to a third dose, that's very important. I want people to understand, though, very clearly that we have a whole toolbox, and there are wins compared with this time last year going into the holidays. We have a toolbox now that we can use that includes booster doses or third doses of vaccine. It includes knowing that masking, ventilation, and some distance work, as well as keeping things outdoors where possible, and also testing where it's available can help us to fill in the gaps when we don't have immediate access to boosters. So lots of things you can do in the meantime to keep yourself safe as you go forward.
Pfizer-BioNTech said today its vaccine failed to produce a potent immune response in children aged 2 to 5, and they are now going to test a third dose. We're not vaccinating kids that young in Canada yet, but does this mean the possibility of that is even further away?
2 to 5-year-olds are a little different from an immune perspective, and we'll get it right. It's just not quite there yet. So a little more time before we're going to probably have access to those vaccines for those folks.
All right, here's a question from a viewer. Who should worry the most about Omicron right now?
Well, the information we have is limited and still coming through. There have been lots of almost rumors that this is not as important or severe a disease, and we're not quite certain about that. So right now, the best advice is presume that you may be susceptible to getting this infection. And if you're someone who, just like before, has complex medical disease, immune suppression, you're being treated for another cancer, and or that you have underlying lung disease or an elevated body weight, those are things you might want to keep in mind, and those might still be risks for more severe disease. So short answer, we don't quite know about Omicron yet. So in the worst case scenario, let's presume that those folks are still at higher risk and keep some extra parts of your toolbox around for prevention while we're figuring that out.
And just super quick last question, follow up. When will we know with certainty whether Omicron leads to mild or serious illness?
Excellent question. I'm dying to find out myself. There are emerging pieces of information from other countries that have seen more of this Omicron for longer, but it is a bit of a time game. We need to see in the real world what happens with people who are vaccinated with the vaccines that we use here in Canada. And right now, we don't know, but over the next 3 to 4 weeks, I think we're going to gain a heck of a lot more information, and we'll be much better armed in the new year to know exactly what's going on. Prudence until then, and no presumption.
All right, Dr. Lisa Barrett, thank you. Big boars, bigger problems. Next, the threat wild pigs pose to Canada's ecosystems. You don't need me to tell you there are plenty of things to worry about these days, but you may not have this one on your radar. Wild pigs. They've become one of the most invasive mammals on the planet and are common in lots of places in Canada, now including Saskatchewan. As Mike Drolet explains, farmers and researchers are sounding the alarm about what an ecological nightmare they are.
To the casual observer, this is nothing more than wildlife. A wild boar tending to her new litter of piglets. But wildlife experts don't see Canadian bacon, they see a pig not native to North America, which could soon become an ecological train wreck for the country.
They are the worst invasive large mammal on the planet.
Ryan Brook is one of exactly 2 Canadian researchers tracking the swine spread. Wild boars were first imported from Europe by farmers in the 1980s. Some escaped, and they were first seen in the wild in the 1990s. Over the following 2 decades, they spread steadily throughout the prairies, but it's since 2010 that researchers have seen exponential growth in their habitat, and they've now been spotted in Ontario and Quebec. Earlier this month, a family of 14 pigs, called a sounder, was caught and euthanized in Pickering, just outside of Toronto. Why does any of this matter? Well, authorities are now trapping wild pigs on the streets of Hong Kong, as well as throughout Europe and the US. They destroy crops, eat pretty much anything they can find, and can transmit swine fever to wildlife and humans alike. In Ontario, they're now an invasive species.
All the restaurants, they're really disappointed. Actually, a lot of people were shocked.
After 20 years in business, Hans Lindenmann has been told by the Ontario government to wrap up his wild boar breeding operation. He says there was no consultation and no option to create stricter regulations.
I totally know that because I'm from Switzerland, because there the government pays millions of dollars each year for compensations for the damage they do. I know the problem, but they should have done it differently, They should have imposed the fencing rules.
For all the fear, Brooks says the wild pig population continues to grow and we're past the point of eradicating them.
Wild pigs, because they have 2 litters per year, 6 young in each litter on average, their growth is so high that you just can't barbecue your way out of a wild pig problem.
But we can, he says, learn from the US and Europe and do our darndest to contain them. Mike Trollet, Global News, Toronto.
And that is Global National for this Friday. I'm Donna Friesen. Tonight's Your Canada is the Fisherman's Memorial Lobster Pot Christmas tree in Leading Tickles, Newfoundland and Labrador. Love that. And we'd love to see your Canada too, especially festive pictures. Please email yours to viewers@globalnational.com. Well, I'm taking some time off for the holidays. I hope you and your loved ones are able to as well and can make the most of what's possible where you live. Thanks for making time for us every night. And on behalf of everyone here at Global National, stay safe, take care of yourselves, and find joy where you can. I'll see you again in 2022. Bye-bye.